Hello everyone, this is Chadi Alraies from New York EVS 2024. I'm really privileged to be with the chairman of the EVS, Dr. Prakash Krishnan, to give us an overview of the 2024 symposium.
Yes.
Professor, thanks for being with us.
Well, thank you so much for the kind interview, and I'd like to just express my gratitude for this. This is really phenomenal. So NYEVS is really a multidisciplinary summit. It's a summit really bringing together all the caregivers in vascular intervention and vascular medicine. So it's a combination of all the multi-specialties, so interventional cardiology, vascular surgery, vascular medicine, and podiatry. Not to mention internal medicine, but the idea here is that who are the people who are in the front line of taking care of these patients. Right. So the goal of this conference has always been to talk about cutting edge care, from soup to nuts, from the diagnosis all the way to the intervention and then to the wound healing. And so this way the patient is always first and always gets the best possible therapy. Right. So in today's day and world, everything is very fragmented. So you have conferences for podiatry, you have conferences for interventional, and so on and so forth. And my goal here was to develop a conference that would encompass all the specialties. But what we've done here is really try to be very proactive in teaching the next generation. So we made the conference a 3-day conference. The first day is a fellows course where we bring in the young minds of all the 3 specialties, interventional cardiology, interventional radiology, and vascular surgery in one room. And what that really creates is this collaboration from a young age, where they are taught by multidisciplinary faculty to sit next to one another, exchange ideas, and understand that the whole goal is treating the patient. Right. The second, then with the endovascular fellows course, we also have a cadaver lab, simulation, so they're able to train. Today and tomorrow, we focus on disease processes. We always have a lecture on medical therapy, and really a world expert today was Dr. Deepak Bhatt. And then we also have live case demonstrations, which demonstrate techniques, bringing in the latest data. And the beauty here is it's to involve the world. So we have an international faculty. We have doctors from Germany who are actually doing the cases just right now as we're speaking today. And this shows that how people in different parts of the world are tackling the difficult cases that we deal with. Absolutely. And we learn from one another. So it's live, and also excellent lectures and discussion.
One of the things you mentioned really very important is to teach the next generation how to work as a multidisciplinary venue. Mm-hmm. When I graduated, personally speaking, I don't know where to get my patient is, so I don't know how to connect with podiatry. It was the last thing to cross my mind because nobody told me that's the way it is. But not is it about only the business aspect, but also to create an access to the patient. Phone number, hey, check this wound.
Absolutely.
Do the vascular study, and then direct them whether endovascular or the vascular surgeon will take care of it.
One of the things we tell everyone is there's so many patients, there's no reason for us to be territorial. The idea here is what's best for the patient. And today we had a patient story with Patrick Curran. And this is a gentleman who was first responder, who was seen by a vascular surgeon, treated by a vascular surgeon, referred to an interventional cardiologist, and that was getting the best possible care. So the whole idea is that it's a teamwork to make the patient better. And I think the field is evolving and will be better, and the patient care will be better if we all work together, which seems innate, but it's very difficult to translate. And the goal of this meeting is to try to do that.
Krishna, you are a visionary, you are a leader, and definitely you're showing everybody the pathway, how we should progress and pursue endovascular therapy for these patients. What is your goal, and where are you going with this meeting forward?
Well, my goal, without a question, is the patients first, as is all the physicians in this room's goal, and to educate. So I think our goal is very simple. How can we deliver the best care for the patient regardless of therapy? And use the data that's available and pass that along to the next generation, teach them the appropriate techniques, and also learn from them. They also are very, very wise in the comments that they make, and we learn. So really to create that forum of discussion. I mean, if I was to put it in one sentence, to develop a forum of open discussion without biases in order to learn from one another in what is the best approach to treat the patient.
Thank you so much for this vision. Really, we're closing with this phenomenal statement. I would like to thank you for all what you have done for the fellows, faculty, and also the visiting people from international. We have a lot of international presence here.
Yes, we do. We have a lot of international, and shows the global nature of the conference, and more importantly, the fact that it's everyone in the world is treating the same thing, so we need to learn from one another.
Also, thank you so much, Krishna, for doing this.
Thank you.
Watch these videos and others, and YouTube channel. This is Chadi Alraies coming to you from EVS, New York EVS 2024.
Thank you.
Thanks again.